Hey girl, hey, this is Dr. Tasha and I am back with a Medical Monday moment. If you are new to us, welcome. We love you. This is where we talk about honest medicine. I give you the real scoop on how to handle situations that y'all have been having trouble with and with vibes and a little bit of comedy mixed in too. So welcome. If you are not subscribed, hit the pause button and subscribe. You will not regret it. If you are subscribed, are you a member? Or what you waiting for? Because we get it down here for the members, if you didn't know. So y'all know, I'm not sure. This week I'm actually in my office, and y'all know that is hell week. And so I want to say either the weekend, probably the weekend or early next week, I'm going live, and it's going to be a whole stone gas, honey. So it's going to be on Instagram as well as YouTube, but we're going to do an extension, and it's going to be a private live, a private chat with my members. So what you waiting for? Okay, so a little bit of background stuff. Today we're going to talk about discharge and diet, honey. I'm going in on y'all, period. All the big back behavior, all the foolishness. This is a safe place. This is a safe place. And we're going to have a conversation, okay? But we're going to have a conversation, honey. All right, so, yeah, retreat, girls. I stretch my hands to thee. Good day in the morning, okay? I'm just letting y'all know this thing is going to be, like, I'm literally excited. First of all, I don't even have to keep everything flowing. I can buzz around and talk to people because who's our MC? Ariel Jenkins Jr. Y'all know her, the girl who be calling y'all silverback gorillas and German shepherds on the Instagram, funny as hell. She is our MC. Love her down. She will be in the building. Everything. So essentially, most of the speakers, minus like one or two, are all black females. Everybody's black, but one or two are males. But other than that, it's all black females. The thing is run black females, bartender, black female, chef, black female, charcuterie cart person, supervisor, black female. What y'all talking about? What? Hotel is managed by a black female. We're not playing no games, because guess what we're gonna do? Every person coming to this retreat, y'all are putting up good reviews on this hotel, because it's just what? We're gonna have a stone gas, honey. And the last, just so y'all know, on Saturday, the medical informational is a sex session, and that is with our sex therapist, and there will be two people doing instructionals. Gonna be teaching y'all how to do stuff. So like they say in church, you're gonna leave better than you came. I'm just saying. Okay, so anyways, yeah, so if you don't know where to get the retreat tickets, go to cleanandcute.shop, hit that shop tab, and they're right in there. Yes, we still have tickets. Boom, bam. So make it get but anyway, so there's that. Now let's get on to today's situation. You know, I have seen, I know it is getting to that season, honey. I be on y'all about people about to start turning on the heat, and not here in Atlanta, because it's 90 degrees. Not here in Atlanta, okay? But somewhere in this country, it's about to turn cold. And somebody gonna turn on them heat warmers, them seat warmers. Y'all gonna be having on them thick pants and sitting on people's couches. And we got to get these aromas together. We got to get them together, because it's disrespectful going up in somebody's house knowing that you got the spirit of tilapia on you. You got the spirit of tilapia on you, sis, and it's okay. It's okay. We don't judge over here. If you haven't watched my BV video, scroll on back and watch it, and it tells you everything you need to know about getting these aromas together. We done talked about hygiene. We're gonna talk a little bit more today, but we talked a little bit about hygiene. You know, we got some spray for y'all. Do I have any more here? I don't know, but we got some spray for y'all, so y'all can, you know, make sure y'all clock. We don't want nobody talking sideways about you, okay? But so, you know, again, we got to check for BV. We got to check for AB. Y'all ain't know about that, did y'all? Because BV is an anaerobic vaginitis, but AB is aerobic vaginitis. It's the situation. Plus the cervical infection. So y'all know it's a time. It's a lot that's going on. And if you watch my videos, if you haven't and you're new, go ahead and pause this thing, subscribe so you can scroll back and get tight with it. But also I've been seeing a lot recently of women who are coming in with a lot of discharge, so much so that they have to wear panty liners, so much so that they're changing their panty liners midday. Y'all catching this blinking. You're discharging so much that you're changing that panty liner midday. Okay, I applaud you for making sure you're changing it and making sure you staying on top of this thing. But these women are not really having any odor. It's just discharge. Like, what is going on? And so when people are like, I don't really have any odor, I'm always saying to myself, yes, you do, sis. Because most times they do. But they just so used to it. But I don't really have any odor. It doesn't burn. It doesn't itch. It's just discharge. And it's kind of just pouring. And I'm like, okay. And it's really interesting because I saw that for the first time probably about 8 years ago. And there was a patient, real specific with the 8 years, but it was like 8 years ago. Because I remember this because she had come to me and she was just having this discharge, and I checked for everything known to man. This lady had nothing. I mean, this lady, she ain't have none of the types of BB, no yeast, no cervix. This lady had nothing, no HPV. PAP was normal. So she had me scratching my head for a minute. So I said, hold up, we got to talk again. You know, I learned in medicine, if it's not adding up, then you've missed something. The story is, you've missed something. So we went back and we had a conversation, and the whole night I was like, I think that you should probably talk to your husband, and he needs to see a urologist if he's not seeing a urologist. When's the last time he's been to the doctor? Is he seeing a urologist? So long and short of the story, he went to see a urologist. The man had testicular cancer. So her vagina was producing a lot of white blood cells in response to what was happening with her partner's semen. And got him straight. She got straight. All was well. And I hadn't really seen it a lot until about a year ago. And I've started to see it, and I'm starting to see it. And here's what it's looking like. Like I said, it's just discharge. A lot of times it's just white discharge. It looks BV-ish, right? But it doesn't smell BV-ish. It doesn't irritate. It doesn't itch. It doesn't burn. It's just present. And again, a lot of doctors don't even test for all the stuff I test for. But even if they did, everything is coming back negative. And so in my mind, I'm always like, you know, I just have this real analytical mind, and I'm always like, what could be causing this? What could be causing this? If it's not infectious, then it's white blood cells. What is causing this? What do we have happening? So I'm always thinking about worst case scenario. Sometimes if you have drainage, but it's more watery drainage, then we kind of have to take a look at the fallopian tubes and make sure there's no fallopian tube cancer or anything like that. When it's more watery, but bloody water or kind of like watery drainage, get an ultrasound, take a look at them fallopian tubes, make sure they're looking good. And I'm always like, well, if it's something from up above, like the uterus or something like that, it's going to be tender, it's going to be uncomfortable. So, and again, that's more of an infectious type of a thing. It will pop up on the aerobic or the AV panel. So what is really happening? And again, in looking back at what happened with this lady's husband, no, I'm not saying that everybody's partner, you know, has an issue, because 9 times out of 10, the person who I just diagnosed and who I just treated, she's not sexually active at all. So it's not her partner. And I'm noticing, guys, that when I'm seeing, because people don't get that your vagina is a mucous membrane. Just like your mouth has saliva, your ears have wax, your eyes have, you know, drainage, and mucus in your eyes and all the things, you know, your nose got boogers, your vagina has discharge, and your vagina is going to respond to things happening in your body, oftentimes things that we're eating, environmental things. Now, what I'm starting to see a lot of is diet propelled discharge. I can't call it vaginitis because it's not a vaginitis, but it's a diet controlled type of a discharge. And it's really interesting because when it comes to bacterial vaginosis or vaginitis or BV, however you want to call it, is all the same thing. That is more with respect to what your partner is eating, right? You can get that. It's not sexually transmitted BV, but it can be sexually associated with a partner and their semen, and everything a man does is in his semen. So if it's taking a particular medication or not taking a medication for his condition, not eating vegetables, eating a bunch of fast food, Takis, all this craziness, drinking a bunch of juice, not drinking water, his semen will be altered, and that will then alter your vagina, and it can cause a vaginitis. But not what you eat. Now, what you eat can cause issues with yeast and yeast infections, because yeast loves sugar. So all those carbs, all the candies, all the sugars, not drinking water, run those yeast infections. Yes, ma'am, that can, yes, absolutely. But not when it comes to a vaginitis, or what we call leukorrhea, which leuko means white blood cells and just pouring out of the vagina. And so, but I've seen that leukorrhea is now associated, and I'm starting to see a lot of association with food. I really want to talk to you guys. We are in a bad place now. Outside of what's happening politically, we all know, child, be careful when you go out, because ain't nobody checking food. It might be dirty. Somebody might have pooped and, used the hand. Child, ain't nobody out here checking. I don't even know. It's a banana republic, child. It's a mess out here. But that's why I'm going to go ahead and cook at home. I'm going to go ahead and stay at the house. Save me some money. Save me some frustration from cursing out a service person that got me twisted, because, yeah, I'm still that person. Okay? Just save me some bread, save me some time, save me some energy. And I know what's in my food. I'm going to cook at the house. I don't even get food from the grocery store. Run me to the farmer's market, because I can't. I can't. I've tried to process it, and I just can't. Okay. All the chemicals, the this, the that, who's putting wax on what, who's buying what, who's genetically modified. Girl, it is too much. I can't do it. Run me down to the farmer's market to give me some vegetables and some meats and some fishes. And so, but to get back to, I want you guys to understand how bad processed food is for you. And when I say processed food, anything that's not fresh and that's cooked, that is your fast foods, that is your restaurants, all the restaurants, no matter how fancy, no matter how bottom line, if you got a real fancy restaurant, they all get their food from the same distributor. Let me be clear. So whether you eating at Ruth's Chris, and not specifically Ruth's Chris, because it's the first thing that came to my mind, or whether you eating at Applebee's, or Chili's, Applebee's, Longhorn, all of them kind of mid-range, all of them little, don't matter which restaurant you eating at. It's the difference. And Raheem is over here cooking, and Raul is over here cooking, but the food is the same. Okay, so they're gonna fancy it up a little bit, but the food is the same. It causes a crap load of inflammation in your body. When you have inflammation, you have fluid retention, you have swelling, you have pain, you have joint issues, you have anxiety, you have depression. Ugh. Like, it is astounding what the level of inflammation does in your body. Let me get to, and this is, you don't believe me, check it. It was a whole video on Facebook. This guy he just broke it down, went into Chick-fil-A, because I'm a hater of Chick-fil-A. I'm sorry. It's not that I hate their food. I don't eat their food, but I know how unhealthy it is. And I look at the lines that are coming out of the store, and I'm like, my God, good God, today, y'all just don't even understand what you're doing to yourself. Like, this man was like, there are 55 ingredients in the basic chicken sandwich, like the thing that got the chicken in the roll, and it got like one pickle on it, right? How they got one pickle? Anyway, don't get me started with that damn sandwich. But 55 ingredients, and one of them is sodium aluminum phosphate. Sodium aluminum phosphate is known to cause neurological disease. That's the brain, that's the nerves, that's the spinal cord, like neurological disease. Why I gotta be in the chicken? Another thing is cooked with soybean oil. Soybean oil is one of the worst seed oils that you could possibly have. Like, it is horrific and horrendous, okay? Like, it is associated with inflammation. It is associated with autoimmune disease. It is associated with cancer. What we doing? And it's like, once y'all get a value meal, and not a value meal, because one of them meals is what, like $25? Okay, so once y'all get a meal, it seems like y'all addicted and y'all keep going back, and it's nasty. If the chicken don't have no flavor, let it get cold. Let it get cold, and then try to go back to it. I'm just saying. And I'm not necessarily picking on Chick-fil-A. I'm just saying all the fast food industries, all the fast food stuff, that stuff is chemical based, laced with chemicals, and we can't figure out, because what do? We're in a rush, we're moving, we're working, we're doing and again, no judgment, but we're giving this stuff to our kids. We're giving it to our kids. We will stop and get a Chick-fil-A meal for these kids in a minute. Have y'all noticed? And if you have teenage kids, I want you to start paying attention, and I want you to start paying attention to the people around you. These teenagers got cankles. If you're my age, you know what a cankle is. The calf is the same from the knee all the way to the ankle. It's a cankle. Why are you 16 with a cankle? That is a vascular issue starting to develop. What are we doing? Little boys, anywhere from the age of 8, and not, I mean, the chubby ones, they're going to have little breast mounds because they chubby. But like regular size, they got little breast mounds. What y'all doing? The food is estrogenizing them, which is then subsequently decreasing your testosterone. Like, what are we doing? And then we can't figure out the ADHD. We can't figure out, you know, what is it? The autism, the ADHD. And I'm not saying this causes it. I'm not saying this, but it's a lot of stuff we ain't figured out. It's a lot of stuff we ain't figured out. And it's a lot of stuff it's a lot. It's a lot. And we ain't figured a lot of it out. We know we have so much. We got oppositional defiant hyperactivity disorder. We got this, we got that, we got that, we got that. And I'm not saying that any of these things are the cause. So please do not attack me in the comments, because y'all know I got time. Do not attack me in the comments. I'm just saying, for us to be in such an unhealthy and uncertain time, like, please be mindful of what you put in your body and your kids' body as well. Oftentimes too, if there is allergies, or like you have, like if you're allergic to something, people think that when you're allergic, your throat gonna itch, or your throat gonna close up, or you're gonna be itchy all over. Not necessarily. Not necessarily. So another thing that I will do in the practice, because I'll be like, okay, run me and tell me what you're eating. Are you drinking alkaline water? Are you drinking water, period? Are you detoxing at all? Like, what are we doing? And then one of the things that I check for is food allergies, but unknown food allergies. So listen, I'm gonna give you a minute, sis. I'm gonna give you a minute to go get a pen. I'm gonna give you a minute. Okay, minute. Okay, so I will send my patients. I have another lab. Shout out to Path Group. They're the bomb. But I have another lab, Path Group. They give all y'all specialty testing. They get me testing down to the minuscule. I know everything that's going on in your coochie, sis. But they don't do this particular test. And believe it or not, this lab just disgusts me. But LabCorp, okay. They do a test called, it's an IgG allergen. I think it's IgG, yeah. IgG allergen 95 food. That's what it's called. If you go to your doctor, tell them, can you order the IgG allergen, ALLERGEN, in parentheses 95, and then it's food. That will give you, and it'll tell you, like, out of 95 different foods, what foods you're allergic to. And it's a grade. So like starting at 2, it's like a mild allergy. That ain't about nothing. It's like you're going to eat something. You might scratch your face once and keep it pushing. But that 2 can go all the way up to whatever random number. And I've had people who are just like, I love meat, I love meat, I love meat. Baby, they allergic to chicken, they allergic to beef, they allergic to rice, they allergic to corn. Everything they eat every day, they allergic to, they would have never known. What do you think is happening? The inflammation is in your body is mounting, and that inflammation attacks your organs. It attacks your kidneys, it attacks your liver, it attacks your heart. So when you are eating crazy like that, you may not see any issues immediately, but it's happening. It's happening, and on an everyday basis, it is happening. So, you know, a friend of mine convicted me one time, and shout out to Dr. April Speed. And she said, and she was very clear, when you eat, you're either fighting disease or you're feeding it. And I love her for doing this, but low key, like when we was, I was eating a Little Debbie. I was eating a Little Debbie when she said that. And she had, I changed my big backed ways. And I'm not saying I'm skinny, okay? And I ain't by skinny by any stretch of the imagination. I don't even know if that's ever my ministry, you know, because, you know, I got some big backs in my family now. I'm talking about 6 feet, 300 pounds, gargantuans, okay? So skinny might not be in my future, okay? But I ain't no big back, like, you know, because I put them little, that was my backsliding ways, baby. I don't put them little Debbies down. They good though. Them zebra cakes ain't never bother nobody. But I can't even in my mind like conceptualize or rationalize putting something like that in my body. I just like, I don't, and I'm not judging anybody because you might be watching this eating a zebra cake. Rock out, sis. Do what you got to do. Rock out, homie. Do what you got to do. But I'm just saying for me, and that statement really moved me. And I say it to my patients all the time who are in my weight management program. Either you're fighting disease or feeding it. So tell me what you're trying to do. I mean, because today might be a feeding disease day and we're not going to judge you. But tomorrow we're going to have a fighting disease day. Okay. So you just need to understand that you either on one side or the other. And so I think a lot of what we're seeing is really your body crying out, your body asking you like, sis, please, you're killing me over here. You're killing me over here. Not literally immediately, but figuratively. So, like I said, I mean, if you have a discharge and you have infection, again, y'all know how I play. Say to your doctor, doc, I need you to check a BV panel and an AV panel. Your doctor gonna be like, what's AV? Be like, ugh, can you please go and watch Dr. Rogers, please? Like, cause y'all sometimes gotta help these doctors out, and it's okay. It's no big deal as long as you get the best care. But if you are negative for BV, you negative for AV, you negative for a cervical infection, you negative for yeast, and you just got this discharge you're going, I can promise you is what you're putting in your body. Back off them carbs, drink some water, get to walking. Walking is that, girl, y'all don't understand. It decreases your blood pressure, your blood sugar, and it increases your serotonin, which is your happy hormone. So it decreases your anxiety and depression. Girl, walk. Well, you ain't got to be no member, no fancy gym, because them trainers don't be knowing what they doing anyway. So walk, okay? Get and watch how things change now. A couple things as far as bathing, because we want to make sure we're bathing appropriately. Y'all know her. If you don't know her, this is the Clean and Cute body wash. It's like one of, you just gotta smell it. Anyway, smell-o-vision, but this is the Clean and Cute body wash bar. Okay, yes, yes, this is her. She's amazing. Love it, love it, love it. A lot of my patients be like, honey, it takes care of my discharge too. I don't know. I'm not claiming all that. All I'm saying is that it's amazing. It's all natural. It's amazing for your skin. It smells amazing. And it's not going to contribute to no smells on those cooch parts, okay? Now, also as far as, y'all, cleaning, now I don't have any panty wash here. I don't know, maybe it's, I don't know. I must have used it all and didn't re-up, but the girl got some home. Because I was doing my laundry and I got stopped and I ain't finished doing my laundry. But anyway, so this is the Clean and Cute home. This is what we clean our linens with. Our clothes, our regular clothes, our street clothes, our linens. This is what we use. And the most important thing that I'm really obsessed with the home is that one of the bugs per se that I was really fixated on making sure that the preservative kills is Bacteroides, which is the bacteria that's responsible for acne. And so therefore, when you wash your linen, you don't have to be worried about the detergent giving you acne. No detergent is going to give you acne on your towels or anything like that. So home is that girl. And I love her to pieces. So first of all, we want to make sure we're starting with, you know, making sure we're at the doctor, making sure if there's any infection, we're treating our infections properly. We want to make sure that we're bathing appropriately daily at least, making sure we're cleaning our linen. Make sure your linen is clean. Like, I mean, me, I'm a once a week kind of girl. Once a week, okay? And then, you know, if this little hair color, because all this black ain't natural, y'all, because these grays be trying me. So if a little hair color come off on my pillowcases, it's a wrap. I'm changing the pillowcase. I don't play about it. You see, I got like one pimple right here and I'm disturbed about it. But anyways, just, you know, overall cleanliness, you have to think about that. But yes, that's outside your body. And so many people are trying to fix what's going on outside their body without fixing what's happening inside your body. Take it slow. Take it like, okay, I'm not going to drink anything that has any sugar, artificial, whatever in it. You want some lemonade? Squeeze some lemons. Squeeze some lemons. I'm a monk fruit kind of a girl. But if you're a honey kind of a girl and a guave kind of a girl, use raw sugar, raw cane sugar, whatever. But get away from all these processed, all these colors. Stop doing that to your kids. Stop doing it to yourself. It is not without consequence. And watch you change your diet. Watch you change your life. Watch you be a little bit more cognizant about what you put in your body, and watch how things change about what comes out of your body. Again, ask your doctor if you have a suspicion or you kind of just really want to know what foods you're allergic to. You ain't got to do that little rash skin test. You ain't got to do all that, child. They're going to draw about 3 tubes of blood. It's a good amount of blood. They're going to draw about 3 tubes of blood, send it off to LabCorp. LabCorp take about a week to get that thing back. Again, IgG, allergen 95 foods. That's what it says on it. That's what it says on the thing. I don't know the test number or nothing like that, but write that down. Your doctor can put that on the page in the requisition, give it to the lab person, whoever, and it will come back, okay? And that's kind of just how you get started. Now, again, if your number is down at like 2, I wouldn't worry about that. But when you start to get up to 6, 7, 8, 9, 10, oh, you allergic, baby. You allergic. You got all kinds of inflammation going on, all types of stuff in your body. But we just, got to do what we can to fight as much disease as we can, and just to stay as healthy as we can from all aspects. Everything that comes out the vagina ain't infected, but everything that comes out of the vagina tells a story. It tells a story. And so you just want to be making sure you're getting all the bang for your buck, okay? All right, so I hope this video helps somebody. And again, I'm not trying to convict anybody. I'm not trying to judge anybody. You like what you like. That's you, sis. It's your mouth. It is your body. It is your back. That's your back. Your back, okay? And your coochie. I'm just trying to help. I'm just trying to help, sis, okay? So at the end of said day, please don't feel convicted, because that wasn't the purpose of this. The purpose of this is to say, hey, for you sisters who are not necessarily infected and still have a problem, this is where we're going to start. This is what we're going to start to do. This is where we're going to start to solve the problem. Okay, so I hope this helps somebody. I hope this blessed somebody as usual. Drop in the comments if you've had this situation, and no shame, no shade, no shame. Okay, so drop in the comments if you've had this situation, and just let me know too, guys, if your doctor is willing to test you for this, and what you've learned. Scroll back, follow back, and let me know what the tea is. But thank you so much for joining me for Monday Medical Moment. Love y'all. See y'all on Thursday, and don't forget to get your retreat tickets, because we getting pretty close to capacity, y'all. All right then, bye.